Good evening, everybody. It's a great pleasure that welcome everybody to the middle of where I am in South Australia. It's very cold and wintry part of the year. And it gives me great pleasure to welcome you to the third Influenza COVID RSV discussion webinar, which is a follow-up from last month. My name's Rodney Pearce. I'm practicing GP in Adelaide and current chair of the Immunisation Coalition. In the spirit of reconciliation, the Immunisation Coalition acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders people here today. So the plan of this webinar is that we are here to have a multidisciplinary group, and I'll introduce them all to you in a second, but we want to discuss flu, COVID and RSV and other circulating infections, what impact they're having onto our community. And we want to share the different perspectives that we have across general practice, hospitals, pharmacy and in the community, and how we're managing this, how our community is managing. So we hope this makes you feel that you've kept abreast with what's happening with COVID, RSV, and what we can do to minimise those infections. Share strategies that you've been using and we've been doing, and we invite people to ask questions, and I'll come to that in a second when we can put that through the chat. And try to align what we're doing with what the government is doing to make sure that the government and our programs are together. An update on how the respiratory season is tracking, what initiatives seem to be working and what's not working. Potential insights into how the general public feel about vaccinations and reflect on it after the pandemic, and how this may be impacting on vaccinations, and maybe how we can put this information aside and maybe do better next year. So joining me tonight, I've got four experts. Firstly, Professor Lou Irving, who is a respiratory physician at Royal Melbourne Hospital at Peter Mac. He's also head of lung cancer stream and is the director of clinical training. His research interests include respiratory infections, lung cancer, COPD, and advanced bronchoscopy. Welcome, Lou. Next, Dr. Ikram Abdi, Lou, as a social scientist and research fellow at the University of Sydney. Her research aims to understand the social context of health behaviours to help develop interventions, tools and programs both in Australia and globally to overcome barriers to vaccination. She is passionate about health equity, and it's an important part of tonight's discussion, and conducting research that drives policy change, and is currently investigating the policy and program level barriers to implementing vaccination strategies for refugee and migrant populations. Welcome. Next, I've got Nicole Lanham, is a pharmacist advisor at the Pharmacy Guild. She's passionate about pharmacy, particularly in the expanding area and scope of practice for community pharmacy. She enjoys connecting with the public and their colleagues, ensuring they feel comfortable and are heard. So welcome. And lastly, Catherine Keel, a nurse practitioner specialising in travel health and immunisation, and is a member of the International Society of Travel Medicine and a fellow of the Faculty of Travel Medicine, Australasian College of Tropical Medicine. Welcome, everyone. So a chance to pick the brains of these interesting group of people. The chat function is the process that we want, so people can see that most of us have used Zoom. You can see that you can put any questions there, so we will be trying to answer them as we go. If you have any questions, please put them on there. I'll be getting an update on my phone, so apologies for looking aside, but I'm checking to make sure that any questions are coming through to me. So if they're not in the chat or we're not answering, and the panel will look at answering them as we go. And remember that anything that we actually don't answer tonight, because we're planning to be finished on time in about 3/4 of an hour, we would like to have your address so that we can get back to you. And if there's any questions directed at anyone of the audience who doesn't get a chance to answer, we want to make sure and we're comfortable to follow that up. So finally, I'd like to acknowledge CSL, Seqirus, Sanofi and BioSelect for supporting this education activity. So let's get started. And to start with, I want to look at some of the updated information and what are some of the broad pictures. Some both good news and bad news. The influenza vaccination rates are low. Looking at aspirin and looking at the national data, there's a suggestion that maybe the influenza cases are slowing off, maybe not as high. Another message, which is interesting, Queensland and Western Australia free flu vaccination programs don't appear to be making a difference, and we'll get to talk about that. COVID infections are significantly lower nationally than in 2023. Booster rates for high risk are low, so there's a challenge for us to think about that and what that means. RSV is high. Also an important and interesting conversation, and other infections. And around the hospitals, we're seeing some interesting surprises. So I might flick to Lou to start with to say, what is it we're seeing in the hospitals? Because we've got these standard things that we're sort of expecting, but what's the news at the hospital front, Lou?
Well, the hospitals are literally being overwhelmed with acute respiratory infections, and it's a sort of a sea of different organisms. We're certainly seeing influenza, COVID, RSV. We're seeing the usual bacterial pneumonias, pneumococcal, and as everyone knows, pneumococcal pneumonia occurs around the year, but it increases at this time because a preceding viral respiratory infection reduces temporarily innate immunity and predisposes to secondary bacterial pneumonia. So a lot of the experienced GP colleagues in the audience will know this pattern of taking a history of someone who gets a head cold 7 to 10 days previously and is now turning up with a fever and a productive cough. And that's pretty easy to diagnose pneumococcal pneumonia. However, a sort of a new variant is that we're also seeing quite a bit of atypical pneumonia, but particularly mycoplasma. And it's staying, in our experience, it's staying true to form. It's affecting mainly young adults, but it is causing confusion because some of the young adults can also turn up with a typical pneumonia, such as pneumococcal pneumonia. So it just, we've got to be vigilant. And if someone has a clear bacterial pneumonia, they need to be covered both with typical and atypical antibiotics.
That's an important message, and I think find out what the diagnosis is, but also remember there's bacterial infections, but also know what's circulating. And I think, Catherine, we were talking earlier, you were looking at some local knowledge, and we made it a note about the COVID. So, and I think you're from South Australia. So what's being reported on? Do we get excited because the COVID is disappearing? Is that the sort of feel?
Unfortunately, not in South Australia. We're kind of seeing in the last few weeks increased cases. So this was taken from SA Health, and the new cases reported in the week prior to Friday, the 14th of June, was 1,666 cases and also 28 deaths. So it's a little bit different in South Australia. We are definitely seeing a little surge in COVID cases.
So that kind of raises the interesting question of, we're seeing COVID. We don't really expect COVID to be a seasonal infection because we think it's out of sync, but maybe people aren't being vaccinated. And I noticed some of the national figures around COVID vaccines. So I'm just thinking, Ikram, any comments as to what you think could be the reason why people aren't rushing back to get in vaccinated, because it seems pretty obvious that we've got these vaccines. Everyone should love them because we've talked about them, shouldn't say to death for the last, but we've talked about them for a long time. But there seems to be a drop off in people who should be getting vaccinated. So any comments and your thoughts and your perspective?
Yeah, so I think a lot of factors could be contributing to this trend. One big issue I think we're obviously seeing is vaccination burnout from the pandemic. So with all the focus on COVID-19 vaccines, and there might be a bit of fatigue when it comes to getting other vaccines. Then of course there's also the ongoing problem of misinformation, and I'm sure like a lot of healthcare providers in the chat today can speak more to that. And there's still a lot of myths floating around even flu vaccines and their effectiveness, and clearing up these misunderstandings through obviously education and trustworthy sources is key. Access could also be an issue, and I know equity has been a recurring theme in these webinars. So that could be a factor. Some people might just question whether the flu shot really even works, especially if they've had the flu despite getting vaccinated in the past, and people have just become complacent too. So there's a lot of factors beyond vaccine hesitancy that do contribute to the low vaccination rates.
So Nicole, in the sector that you work at, the plan is that you make yourself available, and everyone should come flooding to be vaccinated. Do you think that's been the sort of success story in the last couple of years of having extra providers?
Yeah, I do. I think that having community pharmacy come on board and provide vaccinations for people, particularly those that are vulnerable, they're not able to get into their doctors all the time, or they're not able to get an appointment at any given time. I think having pharmacies on board and providing all vaccinations is an amazing initiative for patient access.
So on that basis, we should see twice as much the vaccine should be rates, whereas we've seen in Queensland and West Australia, we really haven't had that surge that we're expecting. So any comments on that?
Yeah, interestingly, Queensland pharmacies have provided 25% of all vaccines across Australia this year for flu, but they have noticed a definite plateau in their vaccination rates. Unsure of how to get this moving, but it's definitely something that we're reminding patients to every time they come into the pharmacy to get those vaccines done.
So Catherine, where you are, you service a slightly different sector than sort of the pharmacy or the GPs. Any feeling of what the issues are, or how you're finding businesses or other places where you're vaccinating? Is it hesitancy, or what may be the reason why we're a bit low?
Yeah, so I run a standalone immunisation clinic and in rural South Australia, and I think that it's a mixture of what has been discussed already. I definitely feel we need a good media campaign, especially for influenza, explaining the severity of the disease. I think people are not informed and not educated how severe the disease can be. I also feel we need a little bit more clarification from ATAGI in regards to COVID-19 vaccines and the recommendations. And I noticed that in the chat just now. We need a little bit more direct terminology rather than just kind of consider a vaccination. I'm finding that when you're discussing it with patients, they don't know whether they should have one or not. So I think we can certainly do a lot more to get those vaccine uptakes. So
maybe I'll flick to you, Lou, about your recommendation. So ATAGI broadly recommends every 6 months, but consider it for a whole lot of other age groups. You sort of on the camp of just give everyone a vaccine whether they need it or not. What's your thoughts, and what do you think the guidelines do to help deliver it from a healthcare provider point of view?
So I quite like the mantra that if you want to avoid a respiratory virus, and if there is an effective vaccine available, you should have the vaccine. And that's a mantra that we've used for influenza vaccination for a number of years, encouraging healthy adults, regardless of their age, to have vaccination. I think it particularly applies to COVID because of long COVID, which is a condition that I've been involved with for a couple of years, and it's certainly a condition that you'd want to avoid. And if there was an effective vaccine, you'd have the vaccine purely, in my mind, to avoid long COVID, if not only to also avoid the acute effects. So a long-winded answer, Rod, but vaccination is an effective and safe way to avoid infection or reduce the risk of and the consequences of infection with influenza, COVID, and now, interestingly, RSV. And with RSV, it's a toe in the water, but I think in a few years' time, we'll be using it in the same way that we use influenza vaccine.
Just thinking about encouraging everyone to be vaccinated, we've got what's commonly referred to by the media as a vaccine for children in Western Australia, Queensland and Western Australia, which is a monoclonal antibody, but we don't have that in all the states. So maybe, Ikram, I can flick to you about, while it's not the conventional vaccine, we've got some states providing vaccines, some are providing them free. So some of the government initiatives are saying, here it is free, but do you think the government kind of campaigns line up with the community campaigns, or is there a bit of dissonance between the government's looking like it's doing it and then some states are doing it, other states aren't? Would you like to comment on that sort of equity and the different messaging and government messaging and community messaging, and then I guess what people talk about over the back fence? Ikram?
Yeah, sorry, that's a lot to cover. But just in general, I think in a post-pandemic, like the pandemic has had a huge impact on consumer confidence, right? So in many ways, it's been a little bit of a double-edged sword for vaccine confidence. On one hand, whilst it's heightened awareness about the role of vaccinations in public health, and people have seen how it protects against infectious diseases, but also there was a lot of rapidly changing and sometimes conflicting information during the pandemic that caused a lot of challenges, and it does undermine public trust in institutions, like especially on the equity component. I think I was speaking to like a co-worker the other day, and because some vaccines are free for some people and then it's not free for others, right? And there's that cost element. So a lot of patients are sometimes like, why should I go out of my way to pay for a vaccine when others are actually, freely accessing it? So I think one way beyond educating consumers about the benefits of vaccinations and things like that, at a health systems level, like we need to be doing more to ensure, because I know different states and territories have different rules and regulations about vaccinations. And in the context of the research that I do with refugee and migrant communities, with refugees in particular, like there's different rules and regulations across different states and territories. So in many ways that does undermine, but that does impact trust in vaccines.
So Nicole, I'm thinking about your environment. What do you think is the magic one-hitter line that you give to people and they always say yes when you persuade them or ask them about the vaccine? What do you think is working for you? What seems to be the secret message?
Yeah, I think just that back to basics message of is your family covered? Are you vaccinated this year? That's the biggest message that we should be getting out there. It's reminding them that this is a yearly thing. And when boosters come up, it's not something that they can just set and forget.
I noticed, Lou, someone said, is there a herd immunity with RSV? And I guess going back to the new vaccine, and we're seeing it in adults, and it's going to be available soon, maybe for pregnant women, and monoclonal for children. But is there such a thing as herd immunity with RSV? Because the current vaccine gives you 2 years, but what's your thoughts on adult RSV herd immunity?
I think it's unlikely. I mean, it does look as though it gives coverage for 2 years, but you'd have to vaccinate an enormous percentage of the herd to see a lasting effect, I think.
And we're not claiming the vaccine stops you getting infection. We're just saying it decreases the severity, I think. Isn't that the claim of it?
Yeah. But it's, I think we need to recognise, and we published a paper on this a couple of years ago, at least at Royal Melbourne, we looked at all the RSV admissions and all the influenza admissions, and the outcomes for the RSV admissions were at least as bad as the influenza ones, and the length of stay was slightly longer, probably because it took us a bit longer to actually diagnose the RSV ones. So it's not a trivial infection in high-risk elderly people.
So, Catherine, flicking to you, what do you think is the magic kind of one question or answer, or your thoughts how to not necessarily persuade the people who are standing back a bit, but maybe people who aren't so keen, or they're getting confused by the message?
I think just being transparent, building a relationship with your health professional, especially I live in a rural area. So just, they come and see me, and they just answer the questions truthfully and transparently, and giving them evidence-based kind of data, and yeah, giving them time to ask their questions and not rushing them. It's really important. I don't think there's any magical cure. I think it's a combination of lots of different factors. I do think media plays a big role in that, in both positive and negative effects, as we can see in another chat comment just put up, was the negative comments in the media about COVID vaccinations has a massive effect on people wanting COVID boosters.
Yeah, I just wanted to add to that, because Catherine, you make some very good points. It's very important to build that trust, right? And by building that trust, to build that trust, we need to be very transparent and clear when sharing information about vaccines. And this means providing all the information, right? So like how it works, their benefits, potential side effects. But it's also very important to be honest about what we do know and what we don't know. So if there are uncertainties, it needs to be acknowledged, and this helps patients or consumers feel like they're being respected and not misled.
Yeah, important point. I'll just go around to Lou, Nicole, and then Catherine. Do you find people are asking you which flu I'm getting? Because they started to get that question with COVID. Everyone says, oh, which one? I want this one, I want that one. Lou, do you think people are pushing back against the brand of flu injections, or is that not an issue?
I haven't seen that, no. And I think my response would be that they're all equally good. I think messaging is really important. And as Ikram said, you've got to be honest, but there are not major differences between the different vaccines. And it's much better that they get a vaccine rather than what we saw in COVID, where people were hanging out for a particular vaccine.
Yeah, it was an unusual. So, Nicole, any comments? Do you finding you're getting people?
I think in community pharmacy, it's important, rather than the brand, to focus on the age range that is available. So they may have one or two that are there for patients, especially those at the younger age ranges. But yeah, it's more the age range rather than the brand.
Catherine, you notice any kickback about have you got the right brand or particular?
Only from health professionals. So everybody who gets a COVID booster wants to know what COVID booster they're having. But, obviously you explain that before you give it, but administer it. Flu vaccines, no. Again, just making sure that they're having the over 65 vaccination. Health professionals who involved in immunizations will ask you which flu vaccine you're administering.
Yeah, and there are some differences with possibly some benefits. So, Ikram, I'm aware that you have another commitment in a short while, but any comments about, do you think the brand is the thing that's stopping people? And maybe your comment on, we've offered free vaccines for under 5s in Queensland and we haven't seemed to notice an uptake. So any comments on your community specifically, or just in general, about removing the barrier of price doesn't seem to have made a difference?
Sorry, Rod, can you repeat the question?
So are you getting asked about a brand? are you getting asked about the cost, and any comments on why Queensland free vaccines for everyone hasn't made a difference?
So with the research that we've done, we're not necessarily being asked about brands. So like Catherine said, it's mostly healthcare workers asking about it. But just in general, in the post-pandemic world, like people are now more aware about these vaccines, and they're more, they're asking a lot more questions, rightfully so. And we also need to be mindful that, vaccine technology is rapidly evolving, right? And it will continuously evolve. And whilst that's very exciting, like we do need to be mindful that with these advancements, there's going to be a lot more concerns, like for patients too. The biggest concern obviously being there's so many options out there, it can get overwhelming. Equity obviously is another one. So it's not just about making them available, but also making sure they reach everyone who needs them, regardless of where they live or their background. I feel like with the communities that I work with, specifically with especially newly arrived refugee and migrant communities, like it's not just accessing the vaccination, obviously that's the barrier, but it's also they have so many competing health priorities that they need to manage as a newly arrived person in the country. So it's like, do they look for housing? Do they look for employment? On top of that, they're experiencing language and communication barriers, right? So there's a lot of factors that we need to be very mindful of.
Any specific word to government that maybe their programs aren't lining up with what you're experiencing on the ground, and would doubling up or having a 3-in-1 vaccine where we had RSV, COVID and flu, or flu and COVID together? Any comments on that?
Any comments on what, sorry?
So if we made 3-in-1 vaccines or 2-in-1 flu and COVID together, or do you think the government programs could align better with maybe some of the community programs that you're working on?
I think other panelists might be able to comment on that, because we haven't really seen any comments regarding that in our line of work.
Okay.
Yeah,
go on.
I'm happy to comment on that. I would definitely say the uptake of vaccines would be higher if there's a combined flu and COVID vaccinations, especially in the older populations, as we are aware they are eligible for shingles vaccines, pneumococcal vaccinations, and quite often there's quite a few that they're due, and they feel quite overwhelmed with the amount of vaccinations that they can have. So any combination vaccines makes it easier to administer.
Yeah, Lou, would you want to comment on that?
So, Rod, at Royal Melbourne, as of today, the staff vaccination rate was 86% or something like that. And that's much higher than a number of years ago. And that's because it's become compulsory. Now, I'm not suggesting that we apply that to the general community, but clearly there are drivers that influence people, and we've got to look at, and that's what ICRM looks at, the different drivers, and one of them is strong encouragement.
Yeah. Sorry, I just wanted to add on to that. So, because we generally tend to hear that the problem is vaccine hesitancy, right? But to fully understand why vaccination rates are really low, like there's a broader set of factors. And in social science, like one way of looking at it is the behavioral and social drivers of vaccination framework developed by the World Health Organization. And basically what this model tells us is that there's so many factors that impact an individual's decision to vaccinate. So you have behavioral factors, so things like perceived disease risk, past experiences with vaccines, level of trust in the vaccine safety and effectiveness. And then we also know that the social environment of an individual heavily influences their vaccination decisions. So you have social factors like family, community norms, and even social media obviously can shape how people view vaccines. And then obviously we have the practical barriers, so the costs that we've spoken about, things like the availability of the vaccine, affordability, service quality. Does the healthcare provider make a recommendation? So these are all factors, obviously, that impact an individual's decision to get vaccinated.
Okay, thank you. Now, I'm conscious that you need to go. Do you want any final comment, ICRM, before you get off?
So I just wanted to address, so there's a comment in the chat just before I hop off. How do we counter is to encourage vaccinations. So obviously, as Catherine and I alluded to earlier, you know, being transparent, being honest is very important. But I also think it's very important to engage healthcare workers. So we did a study during the pandemic, and we were exploring factors influencing patient-provider communication around COVID-19 vaccines during the pandemic. And whilst the vast majority did mention that they were very confident in having conversations with people who have concerns around vaccinations, a lot of them did feel like they needed a lot more support around addressing misinformation. So it's important to empower consumers with information to make informed decisions about their health. But more importantly, healthcare workers are trusted sources of information. So I think it's very important that we equip them with the knowledge and tools that they need to talk about vaccines confidently. So whether it includes training on how to address vaccine hesitancy, how to address misinformation, that's something that's very important. But I just wanted to say, like, there are some resources available. So if you go on the Sky website, so sky.org.au, like, we have a conversation guide around how to address misinformation. And also the National Centre for Immunisation Research and Surveillance have some FAQs around a lot of the stuff that was mentioned in that comment. Yeah.
Thank you. And we'll make sure, the Immunisation Coalition will make sure all of that stuff is available, send it to people who participate. We'll see, we might even put it up on the chat in the short term. But thank you very much, and thank you for the time, because we knew you had some other pressing engagements. So there's a question, Nicole, about...
Thank you for having me.
Absolute pleasure, thank you. Nicole, about the chemists having the over 65 vaccines, and also a question about whether you think you see an expanding role for the pharmacist, having arrived at the table and being an important part of the healthcare system. Any comments about that, Nicole?
Yeah, so each pharmacy chooses their vaccines that they provide. Most community pharmacies in Australia would provide over 65 flu vaccines. It's just up to them whether they stock it or they order it in at the time. A lot of them, just because of the ordering process, would have done that earlier in the year, so they would have the stocks ready to go. As far as community pharmacy coming into the game a little bit more, look, I think community pharmacists are experienced and skilled to provide the services that we're aiming to provide, and to offer patients more access, especially in areas rural and remote where they need that, and they aren't able to access other healthcare professionals. So really excited to see where community pharmacy is going to go over the next 12 to 24 months.
Yeah. So Louis, there's a question about any new vaccines in the pipeline. So my understanding is that there may be a combined flu, but maybe for next year, but I don't think there's any new Pfizer vaccines coming out. But what's your thoughts about chasing the variant? And I guess we do that for flu every season, but do we need to chase the flu or flirt with the chase for COVID? What's your thoughts about keeping up to date?
So I think it's a combination. It's clear that multiple vaccinations against COVID have increased protection, both against the severity of acute disease and very importantly, protection against developing long COVID. Now, however, I'm not sure that it's clear at what point people can have a pause in the immunisation sort of program against COVID. I don't, for people who want to be fully protected, I think having boosters regularly is good. Another way of looking at it is, do you save your booster for when you're putting yourself at most risk? And my experience, the greatest risk is when you hop on an aeroplane, or more importantly, when you go to the airport. And, you know, if you look, but there are other social situations, including nursing homes and so on. So the concept of having targeted vaccination against targeted boosters against COVID, I think is not unreasonable. But it would change very rapidly if a new and more dangerous variant turned up.
So the current advice is that we've gone to a single strain because it's still effective, what's circulating. So flu will be covered by the current vaccine. So we don't need to change our vaccine. So for the moment, giving people the vaccines that are available is still the best because they're still subject to that. But with flu, maybe Lou, flicking back to you, someone's just raised the idea of bird flu, and looking at the data in the last couple of weeks, the bird flu is, I think, coming through the cows somewhere in the US and one human contact, but there hasn't been any. Well, Victoria's the problem state, so you're in Victoria, Lou. So what are the birds doing over there? What's the flu virus doing, and is it jumping to humans yet?
Yeah, so it's certainly causing havoc with birds, but it hasn't successfully crossed into humans except for one or two exceptions. But the ability to spread rapidly amongst humans has not occurred. Those mixing pot type of situations, that we've seen in Asia, where there are a combination of different flu strains, bird, porcine, and human, and then a recombination, so that novel human viruses occur out of either an animal or a bird virus. That has not happened in Victoria, and we probably don't have those mixing pots like they do in Asia.
And it's true to say that the risk of the bird flu jumping to humans is what we've all been anxious about, the next pandemic, because that's potentially how it happens. The swine flu was when it came from Mexico and it jumped from swine to humans. So it's not that common to be, it's reasonably common for the occasional human to get it from an animal, but to be viable to go from human to human from that really is what the pandemic. So that doesn't happen. So we don't need to be scared just because there's lots of birds being put down in Victoria, because it's not like there's thousands just behind the curtain about to jump out and get humans, because it's still in the birds, isn't it?
Yeah, so we need to be scared about human influenza, not bird influenza.
And that's where the vaccines, and we know they work, and we keep on changing. Catherine, in your you do a bit of travel stuff. So when you talk to people about what's happening overseas, do you get them scared and say, be careful, you're going to jump into, you're going to come across a bird and get the first bird flu, or when you come back? Any comments about that?
I always say to my travelers, I'm going to just scare you a little bit into common sense. So just going back to COVID, sorry, one moment, what Lou mentioned, totally agree. We time COVID boosters so they're traveling. So they've had potentially a COVID booster maybe 4 weeks before they travel, ideally, especially if they're on a cruise. And yes, I advise my travelers not to go to wet markets, not to touch any mammals. Obviously we talk about rabies as well. So yeah, we inform them of all that advice.
Yeah, so I guess we are getting the cruises back again, and that was the big scary thing. If we can think back to the COVID spread, we were worried about ships pulling in, and talking to some Queensland programs where they had ships that they sort of kept at bay to stop COVID coming in and all that sort of stuff. But we don't have to be quite that paranoid with flu. And hey, why not get a vaccine? Because that solves the problem. So,
Sorry, Rod, and also pertussis booster. Lots of outbreaks of pertussis. So I know this webinar is not on pertussis, but it's a really key vaccine to be updated in all adults, and obviously children, but also travellers.
Nicole, we haven't really put you under the pressure to say, why haven't the Queensland community jumped at the thought of free vaccines, and why don't you have 10 times the amount of vaccines? Because the Chief Medical Officer, I think, in South Australia says, why do I have to provide free vaccines? Because it hasn't made any difference in Queensland. So why would we? Any comments on that?
Yeah, I don't know specifically if there'd be any other comments on it, but I feel like the vaccine hesitancy is such a big thing, even when it's a free flu vaccine. But if we can get people over that and just remind them of the dangers of long-term effects if they are affected by influenza, RSV, COVID, they never know what's coming for them. So sometimes it might be to put that scare into them a little bit to help them to understand that there is a reason why we vaccinate.
Yeah, it is slightly ironic, isn't it? We've got some of the best vaccines in the world. And what I think goes back to, we've got to educate healthcare providers to be comfortable to talk, and that's been brought up earlier. We've got to be aware of what's circulating, and I think, Catherine, you mentioned that there's a lot of COVID in South Australia. So if you're in South Australia, or as Lou says, in Victoria, you've got to look out for mycoplasma. And I think, Lou, I think that's around the country, isn't there, mycoplasma, because there's a shortage of some of the... So you've got to know what's circulating. So you've got to test. Remember, you can treat COVID, you can treat flu. And don't be surprised when you get a secondary bacterial infection. Is that right, Lou, if you've got it? And as Catherine says, remember, there's other vaccines around as well, and there's other circulating. So know what you've got, and then make some predictions and be aware of what's circulating. So, Lou, any comments on that?
No, I think you've summarised that really well. Rod, I know we're short of time, but I just wanted to highlight this concept of, age. And, we talk about over 60, over 70, over 75, but in reality, there can be a big discrepancy between chronological age and physiological age in the last generations of life. And the respiratory viruses we're talking about can have effects whereby a person who might be chronologically 70 but physiologically 60, they then get the respiratory virus and they end up being at least their chronological age and possibly older, so, and closer to the abyss, so to speak. And and we know that these viruses are the old person's friend, meaning sort of hastening death in people who've got a pretty miserable quality of life. But we don't want them to be an 80-year-old person who's physiologically 70. We don't want them to be their friend, because
It's certainly been, I guess we've learned from COVID, is that increasing the frailty, and RSV is the same. So you can go from a level of frailty to one worse. And as you say, you can be a fit 70-year-old, but suddenly you're an unhealthy 80-year-old as far as frailty. So, and I guess that was a stark reminder with the flu and the associated increased incidence of heart attacks, and the other viruses do the same. So we've only got a minute or so I'll go around. So Nicole, then Catherine, then Lou. But any particularly, you think, one good message, something you'd keep about what we've done in the last 6 months, and something you'd keep and something you wouldn't do, and then Catherine, and then Lou, and then we'll wrap up.
I definitely keep the free flu vaccine programs with just a slight change to the narrative of those, but then changing. There needs to be consistent and aligned messaging to patients that there's no wrong door for where to access vaccination services.
Get the vaccine if you can. All right, Catherine, any comments?
Yeah, I agree. Equity of access. We should all be doing the same thing in all the states and territories, so we all know. Should be media campaigns explaining the need for these vaccinations, and we should keep having webinars like this to educate our healthcare professionals to really promote vaccinations.
Remind everyone who's here on this program is that they're a key to reassuring their community and the people they can provide a vaccine to, that they're critical. So don't lose faith. I guess, Lou, any comments? Anything you think's working well and anything that isn't, Lou?
Well, I think it's well known that people trust healthcare workers and will follow their advice. And the advice is vaccination against respiratory viruses is a simple and effective and safe way of reducing the morbidity and mortality of these viruses.
Thank you. I'd like to thank all the panel members for providing their input, and thank you very much. And on behalf of all, I'd also like to thank our audience and people who've made the comments. And remember, if there's anything you want to send in or later, and we'll make sure that you can get access to this. Thank you for your attendance and your interest. It wraps up our webinar series. We've done 3 of these. We were covering respiratory viruses, current infections, vaccination rates, programs that work and some things that don't, and a glimpse into some of the successes and maybe failures, and maybe reflect on what might be our challenge for next year. Thanks for everyone. We value your feedback. Remember, please let us know what you think of it. There's a webinar, a post-webinar survey, which will be coming up, and please do that. But otherwise, thank you, everyone. Thanks for coming. And we look forward to the challenge for the rest of the year. Thank you.